Morning, everybody. Hope everybody is off to a strong start to the new year. And I want to thank you for joining us for another NC Strong update. Yesterday, I was in Washington, D.C., along with Senator Kevin Corbin and Mayor Esther Manheimer, who are the two co-chairs of the Advisory Council on the Recovery for Western North Carolina. And we met with our congressional delegation. We met with our two U.S. senators. We met with the acting administrator of FEMA. All meetings were very constructive. It's all about trying to move the ball forward and make sure that the federal government is an active and valuable member or contributor, partner to the work of helping Western North Carolina recover. There has been some tough news in the world of health care. The U.S. Congress allowed the ACA tax credits to expire on December 31st. In addition to earlier this summer, cutting Medicaid by $1 trillion. Hundreds of thousands of individuals across North Carolina are seeing their monthly health insurance premiums skyrocket, or they're losing coverage altogether because they simply cannot afford the amount. But I want folks to be assured that I remain as committed as ever to stepping up for the health and well-being of North Carolina families. And today I'm here to provide a couple of updates on how we're doubling down on that commitment. First, we want to talk about some news that came out over the holidays. Late in December, North Carolina was awarded $213 million by the federal government to help us better support health care in the rural parts of our state. NCDHHS, North Carolina Department of Health and Human Services, developed a plan through extensive engagement with more than 420 stakeholders and came up with 6 key strategies, including investing in preventive care, and mental health and substance use disorder treatments, the Rural Health Task Force, and technology and artificial intelligence, and more. North Carolina will use this federal investment to create a Rural Health Innovation Fund to unlock new technologies that can improve people's health. These technologies will help rural providers modernize their practices, giving more time to devote to their patients. This program will make a difference in the lives of many of our rural neighbors, and we are excited to get to work. I will note, however, that this money was funded by the same law that is slashing Medicaid by $1 trillion. Cutting Medicaid by $50 billion here in North Carolina over the next decade. The approximately $1 billion that we will receive through the Rural Health Transformation Program is a positive step, but it is no substitute for the nearly $50 billion the state will lose over the next decade. That said, we're going to do everything we can to make this money help as many people as possible in the 5 years that the program will operate, and we will keep advocating for North Carolina's rural patients, providers, and communities, urging Congress to restore the devastating cuts it has imposed. I will now bring forward Secretary Sangvi to say more about the Rural Health Transformation Program. Secretary.
Thank you, Governor. Good morning, everyone. This is a real unique opportunity for North Carolina and the Department of Health and Human Services. As the Governor outlined, we are eager to work with federal, state, and local partners as we begin implementing the Rural Health Transformation Program across the entire state. As many of you know, North Carolina is home to over 3 million rural residents across all 100 counties. That's the second largest population in the country, second to Texas. And improving the health and well-being of our rural communities is a priority. It's always been a priority at NCDHHS, and we're leading the country in how to address the unique challenges and needs of our rural citizens and residents, and the challenges they're facing from accessing care, getting access to care early, preventing chronic disease. Rural health is not new to North Carolina. Over 50 years ago, we established the Office of Rural Health. That was back in 1973. So we've been focused on rural health far longer than what's been proposed here in the Rural Health Transformation Fund. And we're excited that we can take that experience that we've had in North Carolina and really build on it as we move forward with the RHTP. When this was passed in July, the department was ready to take on all the advantages that would come to it, including the funding that the governor just outlined. As the governor mentioned, we worked with over 420 stakeholders. That's really important. What that's really talking about is that in order for us to be successful in this program, we're going to need the help of all communities. We're going to need to reach all 100 counties And in talking to these 420 stakeholders, we learned about the unique opportunities we have in North Carolina, the programs that are working well, the programs that we really need to double down on. And we will continue to work with all stakeholders as we begin to distribute this funding. So the governor outlined a couple of the things that this funding is intended to do. Let me get a little bit more specific. We're going to launch what we're called local roots hubs. As I mentioned, the best way to do this work is local. What's really unique about the rural communities is that they're even more local, if you will, because so many of the things that are going to be solution-oriented really need to be derived by and really need to capitalize on the things that are already occurring in those communities. So we're going to launch these roots hubs. There'll be 6 of them. They'll be the primary conduit for the funding to then be distributed to other entities. We're expanding prevention, chronic disease management, maternal health, and nutrition programs. We're going to increase access to mental health, including substance disorder treatment services. We're going to invest in the rural health workforce. We're going to support more rural providers in transitioning to what we call value-based care, this idea that we can really figure out how to spend less on health care by spending optimally on health care. And we're going to do simple things, but really important things like expand internet access, and as the governor mentioned, think about how AI can really transform not just rural health care in North Carolina, but health care more generally. So for our first year of the funding, our overall goal is really to expand the reach, existing statewide efforts that align with these RHTP initiatives as we work to set up a strong foundation for long-term sustainability. The previously mentioned initiatives that I just talked about will be implemented through a broad coalition of state agencies, community-based organizations, academic institutions, rural providers, and private sector partners. Simply stated, we really need everyone putting their best mind forward, helping us think about how we can really transform rural healthcare in North Carolina. As soon as the federal funding is received, North Carolina DHHS will establish these statewide roots hubs that I just talked about and engage stakeholders in additional funding discussions. I'm grateful for these federal dollars, and we're eager to work in partnership with federal government, state agencies, statewide stakeholders to prioritize the health and well-being of our rural citizens. We will use every opportunity to advance the health and well-being for all of rural North Carolina. Thank you, Governor.
Thanks, Secretary. Next, I have positive news to share about Sunbucks. Sunbucks is a nutrition program that Congress authorized to launch back in 2024 to feed kids when they are not in school during the summer. As many of you know, summer is among the hungriest time for our children. Hunger does not go on vacation when school lets out. In fact, a lot of kids don't get the breakfast and lunch that they can receive at school when they're at home during the summertime. Too many parents find themselves wondering how they're going to feed their kids. One of these moms is Kayla. She buys all her groceries in bulk to try to stretch her dollars, but she doesn't have funds to add fruits and vegetables to her kids' diet. That's where Sunbucks comes into play. In 2024, North Carolina first took advantage of the Sunbucks program. That year, in partnership with the North Carolina Department of Public Instruction, North Carolina DHHS launched the USDA's Sunbucks program for the first time. Through Sunbucks, eligible families receive a one-time payment of $120 per child to help them buy groceries over the course of the summer. Last summer, Kayla was finally able to add those fruits and vegetables to her kids' diet throughout the entirety of the summer. There are so many stories across North Carolina just like Kayla's, and since launching the program, we have helped more than 1 million children improve their nutrition over the course of summertime. Our state was fortunate to partner with philanthropic groups. They helped us to pay the modest $5 million investment that is necessary to unlock the Sunbucks benefits from the federal government of about $130 million. Now, as everyone is aware, the General Assembly has not passed a budget this year. So there were no appropriated funds to trigger this federal funding. And we were worried that there would be more children who experienced hunger this summer than needed. My office was gravely concerned, so we got to work. And I'm pleased to announce that through a public-private partnership, we are bringing Sunbucks back to North Carolina this summer. We raised about $5 million to help cover from philanthropy to cover the necessary state funding to draw down $125 million in federal funding. That is a leverage of 25 to 1. It's remarkable. I want to thank the Blue Cross and Blue Shield of North Carolina Foundation, the Duke Endowment, Coca-Cola Consolidated, and other partners for stepping up to fill the gap. But the state shouldn't have to scramble each year to make sure that our children are not hungry in the summertime. So I urge the General Assembly to include Sunbucks in the recurring budget for the summer of 2027 and beyond. Don't leave families wondering whether they're going to have adequate resources to properly feed their children. Don't leave moms like Kayla worried. Let's just get it right. And I'm pleased to bring forward Colleen Briggs, who is president of the Blue Cross and Blue Shield of North Carolina Foundation, to talk about why supporting Sunbucks was so important to them. Thank you, Colleen.
Thank you, Governor Stein, for your leadership and for bringing us together today on this program. I'm thrilled to get the opportunity to highlight the Sunbucks program. At Blue Cross of North Carolina, we believe that every child should have access to nutritious food because we know that good nutrition is essential for helping children to grow, to learn, and to live healthier lives. We continue to see firsthand how food insecurity is negatively impacting health and our state. In North Carolina, 1 in 5 children faces hunger. We can and we must do better for the children of the state. We know that when a child lacks nutritious food, it not only harms their health and their development, but it also contributes to the prevalence of diet-related chronic conditions like type 2 diabetes that increase healthcare costs for everyone. The good news, we know what works. Our research continues to show that when we give access to healthy and nutritious food, that we see improvements in health outcomes, and it helps control rising healthcare costs. That is why Sunbucks matters. It ensures that children get the nutritious meals that they need over the summer, even when school is out. It will help reach more than 1 million families all across this state in rural and urban communities. And it helps support local communities by supporting local grocers, local farmers, and fueling local economies. We know that when we give children access to nutritious food, it helps them to grow, to learn, and to thrive, which are all the foundation for lifelong health. We are so proud to work together with so many dedicated leaders across the state around one shared goal. How do we build a brighter and a healthier future for every child in this state? I want to thank the governor and his team again for their leadership on this issue and for keeping a spotlight on this important program. Thank you.
Thanks, Colleen. Secretary Jeff Smythe will join me from the Department of Public Safety. In addition to keeping folks healthy, we have to be focused on keeping people safe. That's why I'm providing an update on my efforts to protect North Carolinians from the public safety threat unmanned drones increasingly present across the state. Last February, President Trump appointed Governor Glenn Youngkin of Virginia and me to serve as co-chairs of the Bipartisan Council of Governors, a group that focuses on National Guard, national security, cybersecurity, and natural disasters. It quickly became apparent to our group that the malicious use of drones had become a real problem around the country. We all know that drones can be incredibly useful. In the aftermath of Hurricane Helene in western North Carolina, we used drones to survey damage, to search for survivors, to direct rescue teams. But the risks are just as real as the rewards. We've seen drones used to deliver contraband to prisons, making the already difficult job of correctional officers even harder. The potential that weaponized drones can be used by bad actors to attack large public gatherings or critical infrastructure, it isn't fiction. In 2026, this year, we will host World Cup soccer tournament in America's many America 250 anniversary celebrations. And whether here in North Carolina they're sporting events or concerts, we will also have a large number of mass gatherings. Securing American airspace is urgent, and federal, state, and local officials each have a role to play in protecting the public. In September, Louisiana Governor Jeff Landry and I led a bipartisan letter of governors to congressional leadership urging Congress to enact legislation to enhance states' capacity to detect and mitigate drone threats. More than 30 governors of both parties signed that letter. In December, Congress included the Safer Skies Act as part of the Defense Reauthorization Law, and President Trump signed that into law. I want to underscore this is a fairly remarkable accomplishment that within a period of 6 months, we raised the profile on an important issue of public safety, and Congress actually got it done. It's a rare bipartisan win. We are all safer for this development. Now, as the Safer Skies Act rules and training are being developed by 4 different federal agencies, we in the Council of Governors are advocating that state and local law enforcement be included in the rulemaking process. Because for the Safer Skies initiative to be successful, effective, the rules must reflect the day-to-day working conditions of state and local law enforcement. This past fall, former Public Safety Secretary Eddie Buffalo led a law enforcement working group to identify ways that the state can mitigate the risks that unmanned aerial systems pose. This group, representing local, state, and federal law enforcement agencies, identified the need for more proactive authority and for additional state laws to protect critical infrastructure. They came to consensus on a common sense draft piece of legislation addressing those issues, and we've started to have conversation with members of the General Assembly, and I plan to work with the General Assembly, again on a bipartisan basis, to see this enacted into law this summer. I will now bring forward Secretary of Public Safety Jeff Smythe to speak to the importance of promoting public safety from the risks of malicious drones. And before he comes forward, I will just say, Secretary Smythe, your second or third week on the job?
Day 8, sir.
Day 8. Secretary Smythe and I worked together at the Department of Justice, where he headed he was the director of the Criminal Justice Training and Standards Division at the Department of Justice. And before that, he was the chief of police of the city of Burlington. Secretary Smythe.
Thank you, Governor. I appreciate that. Good morning, everyone. Sorry about that. I appreciate the Governor's leadership on this issue and the bipartisan work that has brought us to this moment. At the Department of Public Safety, our mission is straightforward. It's safeguarding and preserving the lives and property of the people of North Carolina. Today's conversation about unmanned aircraft systems, or drones, is a good example of that responsibility. Let me start by saying this clearly. Drones are not the enemy. In North Carolina, we use them every day to save lives, as the Governor mentioned, right, during disaster response, search and rescue operations, wildfire monitoring, and hurricane recovery. They're a valuable tool, and they're here to stay. But like any powerful technology, drones can also be misused. Across our state, we've seen drones used, as he said again, to deliver contraband into prisons, surveil sensitive locations, interfere with critical operations, all sorts of issues related to misuse of drones. Nationally and globally, we've seen how rapidly this technology is evolving, becoming more autonomous, more sophisticated, and more accessible to bad actors. That's why the action that Congress took through the Safer Skies Act matters, and why what North Carolina does next is just as important. The federal law gives states and local agencies authority. What it does not do is automatically give us clarity, coordination, and the right tools on the ground. That's where state leadership comes in. Here in North Carolina, we're taking a deliberate and balanced approach. First, we're focusing on protecting critical infrastructure, the places North Carolinians rely on every day: power generation facilities, water systems, ports, transportation hubs, communication networks, and of course our correctional institutions. These are not abstract concepts. If one of these systems is disrupted, families feel it immediately. Second, we are ensuring that law enforcement and correctional officers have clear rules of engagement. Officers should not have to guess what authority they have when a drone is hovering near a critical facility. Clear state law protects the public, and it protects professionals we ask to keep us safe. Third, we're committed to doing this the right way, consistent with federal law, respectful of privacy, narrowly focused on genuine threats. This is not about expanding surveillance. It's about preventing harm and keeping pace with modern risks. The proposed legislation the governor referenced reflects months of collaboration amongst state, local, and federal partners. It represents consensus, not overreach, and it positions North Carolina to be ready, not reactive, as federal rules and training come online. For North Carolinians, the takeaway is simple. You don't have to think about drones to benefit from this work. You benefit when your power stays on. You benefit when your water system is secure. You benefit when law enforcement and correctional officers can do their job safely. You benefit when public safety agencies are prepared for the threats of tomorrow, not just yesterday. We're grateful for the governor's leadership, for our partners in the General Assembly, and for the federal collaboration that made this possible. At the Department of Public Safety, we stand ready to implement these authorities responsibly and transparently with one goal in mind, keeping North Carolina safe. Thank you.
Thank you. And at this point, happy to take questions, and you can direct them to me or any of the speakers on our topics. There is recognition that the damage that Western North Carolina suffered was immense, and appreciation that more needs to come. We're going to work with them to get them comfortable with the $13.5 billion figure, but there was just unanimity that Washington needs to do more, and we look forward to working with them in the coming weeks to get them comfortable with the package and then find the right opportunity to make sure that the funds come. Very gratified after yesterday with the announcement from FEMA that they were approving some reimbursements from public assistance to local jurisdictions that had incurred expenses, in some instances, $15 million, Rutherford County, in debris removal. And they're just waiting on that money to get reimbursed. And you can imagine how significant $15 million is to the annual budget of Rutherford County. So to have that money approved was a very positive step. They also approved the first hazard mitigation grants that they've done in an entirety of the year. So that was a big logjam, a big icebreaker. There's still so much more that needs to be done. So many homeowners, we just had our advisory council that I've put together to help make sure that we're doing our job right when it comes to recovery. We had a meeting last Friday in Rutherford County, coincidentally, and a woman from Buncombe County came to that area, and she said, my house in Swannanoa was destroyed to the point where it's uninhabitable. You cannot live there. I'm still paying a mortgage on that property. I can't do anything with it. I can't sell it. I can't rebuild it. I'm just spending money. Please take this. She raised her hand and said, I want you all to take my property, and it will, the way it works is they buy the property and then it becomes green space forever so that there won't be anyone who experiences pain if there is future flooding. Well, that has not been acted on, and there are dozens. In fact, there were 560 applications of homeowners who similarly said, please, my house is in a flood zone. I'm ready for you to acquire my property to the government. So not all of it's been solved yet. I don't want to overstate it, but what a constructive development yesterday was. Basically, under current federal law, states can prohibit malicious use of drones. So it is already a crime in North Carolina to use a drone to deliver contraband to a prison. There are certain critical infrastructure that the Secretary identified, whether it's electricity or water, telecommunications, that is not yet covered by North Carolina law, and we need to strengthen our law to make sure that it takes care of all of the major risks. What federal law has said until today is that state and local governments were prohibited from mitigating drones, meaning shooting them down if they are malicious. Now, under the Safer Skies Act, if a state or local government goes through a federal training program, they can then have the authority to, when it's appropriate, when there is a risk, to actually take action against a specific drone. Because The current law only holds accountable the person who is directing the drone, but that person may be miles away and you have no idea who they are, but the drone is right there and presents a real and clear present danger. And so that's the change in federal law that we had been seeking. There is draft legislation, and we're just beginning the process to engage with the legislature. Anything else on that, Jeff? No, sir. Yes, sir. They have approved it. Then it has to go through another level of review through DOJ called Defend the Spend. Our hope is that within 1 to 3 weeks, the money will actually be in the bank accounts of these local governments or these property owners. I am concerned, just as anybody would be, that troops were sent somewhere where the need is not clear that they are required. The first order of business is local government. They're the ones who have law enforcement, and I'll have the secretary speak to this because he's lived it as the chief of police. They know their communities. They're of their communities. They are integrated with their communities, have well-trained local law enforcement to keep people safe. There are times when there are events that may require more resources than the local government can muster at that moment. The city of Charlotte had a safe season initiative at the end of the last year on holidays because they wanted to make sure people felt comfortable going around town shopping. And so they asked for some state support to come in and back them up. And so the Highway Patrol and the ALE dispatched extra resources to assist the local law enforcement there. So there is nothing going on that would justify having the president invoke the Insurrection Act in North Carolina. Jeff, I don't know if you want to say anything.
No, I think you covered it.
Thank you. Yes, Will.
Little off topic, but looking at UNC, John Pryor, the chairman of the board, just announced he's stepping down. I'm curious, what your experience has been working with the board that obviously is completely dominated by the other party, and what kind of person you hope would take over the board.
He's no longer board chairman. I think he's just on the board and has resigned his slot. Look, I think the way that the General Assembly has politicized the university system, has politicized the courts, has politicized the Board of Elections, all of this is bad. I don't want to sugarcoat it. We are much better served when the University Board of Governors and the UNC Individual School System Board of Trustees see their mission as embracing higher education, supporting the leadership, setting broad policy, and then letting the president and letting the chancellors do their jobs. That's why we hire them. I think there's been too much intervention by the boards of trustees and board of governors into the operations of our universities that it is absolutely counterproductive. And I think that we would be better served if these were not partisan organs, but rather they represented the broad representation of the entirety of the state, which includes unaffiliated voters, which includes Democratic voters, which includes Republican voters, not exclusively one party. Did you listen to my arguments yesterday when I was talking with the Congress? Because what you said is 100% spot on. The longer the delay in federal funding and getting programs up and running, the worse it is for Western North Carolina recovery. Things have to happen quickly. The quicker we can get resources deployed into local communities, rebuilding homes, rebuilding roads, bridges, water systems, helping small businesses get through what's going to be a tough winter, the stronger the long-term recovery will be. So delay is terrible for two reasons. One, things become more expensive the longer they go on. But the second is the longer it goes on, the harder it is for people to get back up on their feet. We want people looking to the future. What can I do to make a brighter future? And that means getting people to a place of stability, and speed is of the essence. I have to wait till they become more mature and they start coalescing around specific policies. Look, local governments have real needs to provide for their residents. Local governments do. They got to provide police. They got to. Counties need to pay for schools. We have garbage collection. They have road responsibilities. They have water systems. They have real responsibilities that make a difference in the health and vitality of that community. I'm wary when the General Assembly starts to say to local governments, you cannot make for yourself the determination what's in the best interest of your community in terms of the revenues necessary to provide the level of services that people want. So my one sort of overarching concern is, are they going to do things that really make it difficult for local governments to meet the needs of their people? I'm very open to the idea of trying to keep costs on certain vulnerable populations in check, because I recognize that there are certain people who are really struggling with the rising property tax bills that they're facing. And I think there are ways you can do those two things, and I'm eager to see what the General Assembly comes up with.
Do you think exemptions is something that could be looked at, as far as that doesn't change anything for homeowners, but would give the counties more?
I think it's just premature to take one specific piece of it. Let's see what they're talking about in its entirety. But let's also look at that in the context of, what are we doing on the corporate income tax? What are we doing on the personal income tax? What is clear is we need to have a certain amount of revenue just to keep where we are. And there are pre-programmed tax cuts in law that will ensure that we will be in a worse position 2 years from now, to the tune of $2.3 billion, than we are today. Our teachers are among the lowest paid teachers in this country. Our correctional officers, 49th lowest paid. State Highway Patrol, 49th lowest paid. All of our public servants are not adequately compensated for the value they provide to all of us. The idea that when we're not paying enough to have a mental health care system that keeps us all safe. We don't have enough money they haven't fully funded Medicaid yet. When we have all of these real clear needs, the idea that we would 2 years from now have $2.3 billion less to meet we're not doing a good enough job today, just doesn't make sense to me. All right, thank you.
Sure. So, as I mentioned earlier, it's really important for the rural health transformation funds to really be executed and distributed locally. So we're going to set up 6 roots hubs, and they'll really be the coordinating entity to understand what's going to meet the needs of that particular community that they're serving. It's going to be a competitive process, so we're putting out an RFA soon for those who want to participate as a roots hub. And so we'll be able to actually share more tomorrow. We're holding a town hall as well to provide additional details on this. Thank you.
Thanks, everybody.